Hi everyone, welcome to the stream. In today's NCLEX RN quiz, we will go through the question answer flashcards of Ray and Catherine, which are released on 2011. I will show you how to find the book on online or WSR at the end of the video. So first we will discuss about neurological condition in the flashcard.
Injury. 1. The client has sustained a traumatic brain injury, TBI, secondary to a motor vehicle accident. Which signs/symptoms would the emergency department, ED, nurse expect the client to exhibit? L1. Blurred vision, nausea, and right-sided hemiparesis. L2. Increased urinary output, negative Babinski, and ptosis. L3. Autonomic dysreflexia, positive Brudzinski, and hyperpyrexia. L4. Negative dextrostic, nuchal rigidity, and nystagmus. 1. Correct answer 1. Signs/symptoms of TBI include neurological deficits, among them blurred vision, nausea, and right-sided hemiparesis. A positive Babinski sign would also occur with head trauma. Autonomic dysreflexia would be found in a client with a spinal cord injury. A positive dextrostick for glucose would be found in someone with a cerebrospinal fluid leak, and a positive Brudzinski and nuchal rigidity are signs of meningitis. 2. The intensive care nurse is caring for a client diagnosed with a closed head injury. Which data would warrant immediate intervention? L1. The client refuses to cough and deep breathe. L2. The client's Glasgow Coma Scale goes from 13 to 7. L3. The client complains of a frontal headache. L4. The client's mini mental status exam, MMSE, is 30. Category 2. Correct answer 2. A 15 on the Glasgow Coma Scale indicates the client is neurologically intact. A decrease to 7 indicates an increase in the intracranial pressure, which warrants immediate intervention. A 30 on the MMSE indicates the client is cognitively intact. 3. The rehabilitation nurse is caring for the client with a closed head injury. Which cognitive goal would be most appropriate for this client? L1. The client will be able to feed himself/herself independently. L2. The client will attend therapy sessions 3 hours a day. L3. The client will interact appropriately with staff members. L4. The client will be able to stay on task for 15 minutes. 3. Correct answer 4. Cognitive is mental functioning. Therefore, the ability to stay on task would be the client's most appropriate cognitive goal. 4. The intensive care nurse is caring for a client diagnosed with a TBI who is exhibiting decorticate posturing. 3 hours later, the client has flaccid posturing. Which action should the nurse implement first? L1. Notify the client's healthcare provider, HCP, immediately. L2. Prepare to administer mannitol, osmotrol, an osmotic diuretic. L3. Complete a thorough neurological assessment on the client. L4. Reassess the client in 1 hour, including calculating the Glasgow Coma Scale. Correct answer 1. Flaccid posturing is the worst-case scenario for a client with a TBI. Therefore, the nurse should notify the HCP. Completing a neurological assessment, administering an osmotic diuretic, and reassessing the client are all plausible interventions, but they are not the first to be implemented. 5. The emergency department nurse is entering the room of a client who was at a baseball game and was hit in the head with a bat. Which intervention should the nurse implement first? L1. Assess the client's orientation to date, time, and place. L2. Ask the client to squeeze the nurse's fingers. L3. Determine the client's reaction to the door opening. L4. Request the client to move his lower legs. 5. Correct answer 3. The nurse should first determine how alert the client is by noticing the reaction when the door opens. The best reaction is spontaneous opening of the eyes without verbal or noxious stimuli. The other 3 options are appropriate but should not be the nurse's first intervention when entering the client's room. 6. The nurse is preparing the client diagnosed with a head injury for a magnetic resonance imaging, MRI. Which interventions should the nurse implement? Select all that apply. L1. Ask the client if she is claustrophobic. L2. Have the client sign a procedural permit. L3. Determine if the client is allergic to shellfish. L4. Check if the client has any prosthetic devices. L5. Ask the client to empty his/her bladder. 6. Correct answer 1, 4, 5. The client is enclosed in an MRI tube for an extended period, so the client cannot be claustrophobic or want to stop the procedure. An MRI cannot be completed on a client with a metal prosthesis unless it is made with titanium, because the MRI may dislodge the prosthesis. The hospital admission permit covers the MRI, and because no contrast dye is now used in most MRIs, an allergy to shellfish is not pertinent. 7. The client with increased intracranial pressure is receiving mannitol, osmotrol, an osmotic diuretic. Which intervention should the nurse implement? L1. Monitor the client's complete blood cell, CBC, count. L2. Do not administer the drug if the client's apical pulse is less than 60. L3. Ensure that the client's cardiac status is monitored by telemetry. L4. Use a filter needle when administering the medication. 7. Correct answer 4. The nurse must use a filter needle when administering mannitol because crystals may form in the solution and syringe and be inadvertently injected into the client. The CBC and apical pulse are not affected by the medication. Mannitol is administered cautiously in clients with heart failure, but telemetry is not required routinely. 8. The male client is being discharged from the ED after sustaining a minor head injury. Which statement indicates the wife understands the discharge teaching? L1. My husband will be hard to wake up for a couple of days. L2. He doesn't need any pain medication because I have some at home. L3. I should not give my husband anything to eat or drink for 12 hours. L4. I will bring my husband back to the emergency room if he starts vomiting. 8. Correct answer 4. Vomiting indicates an increase in intracranial pressure, which is a complication of a head injury. The client should arouse easily, may eat and drink, not alcohol, and should not take any type of pain medication that would mask mental status. The nurse is discussing the TBI Act at a support group meeting. Which statement best explains the Act? L1. It is a federal act that provides public policy regarding community living for clients with a TBI. L2. It ensures that all public buildings must have access for physically challenged clients. L3. This act ensures that all clients with a TBI have access to rehabilitation services. L4. It is a national policy that establishes guidelines for neurological rehabilitation centers. 9. Correct answer 1. The TBI Act is part of the Children's Act of 2000 and is the only federal legislation designed for clients with a TBI. The Act provides for a balanced public policy for prevention, education, research, and community living for clients with a TBI and their families. 10. The nurse is caring for a female client who sustained a closed head injury 8 days ago due to a motor vehicle accident. Which signs/symptoms would alert the nurse to a complication of the head injury? L1. The client reports having trouble sleeping due to having nightmares about the wreck. L2. The client tells the nurse she has a stuffy nose and green nasal drainage. L3. The client complains of extreme thirst and has an increased urine output. L4. The client informs the nurse that she has started her menstrual period. 10. Correct answer 3. For 7 to 10 days post-head injury, the client is at risk for developing diabetes insipidus, which is a lack of the antidiuretic hormone, resulting in increased urine output and increased thirst.
Visit buzzardbiblio.com and search for NCLEX RN. We'll find so much results. So this is our flashcard. Just click on this. To read the flashcard, below the first image you will see the flashcards. Okay, just plus, take it full screen, scroll the next one. So we have 16 chapters in this flashcard. The next one is cardiovascular, respiratory, same like up to pharmacology. So total 16 sections there. So there are so many interesting quizzes. If you are interested like such topics, please comment below. I will upload the video. Or if you want to find the video, please visit buzzardbiblio.com and read the book on there or get on Amazon. Okay, thank you. Thanks for watching. Please like and share and support my buzzardbiblio.com website. Thank you.